Hi fitness friends, bringing you here a quick video in regards to shoulder mobility and upper back connection. And I thought I'd start with just a very quick short anatomy lesson, kind of giving you some bony structure as well as muscle structure. So if someone were to ask you where your shoulder is, what would you say? Where's your shoulder? Where's your shoulder joint? Right here, right? This is true, shoulder joint. Our shoulder joint is made up of our humerus, this is our arm bone, as it fits into the acromion process it's a bony protrusion coming from the shoulder blade, acromion process. So this joint is actually called glenohumeral joint. Glenofossa is actually the name of the structure in there that holds that arm bone in place. Spinning Starvin Marvin around here, we've got the clavicle, so you can palpitate this. You can palpitate and feel that bony protrusion here of that acromion process. Go ahead and feel that bony, that's the acromion process. Clavicle, right here, okay? So where the clavicle and the acromion meet, that's called the acromioclavicular joint. And then where the sternum, part of the rib cage, where that meets the clavicle, that's called the sternoclavicular joint. Say those two really fast, be like a tongue twister. Now some of the main muscles here that help with the mobility of the shoulder blades, because that's the key area I'm going to talk about here, is the movement in the shoulder blades. Some of the key muscle structures in the upper back here, we've got our trapezius, and we've got like 3 sets of fibers. We've got an upper set of fiber, a medial set of fiber, and then a lower set of trapezius fibers. Then we also have the rhomboids. The rhomboids help to move the shoulder blades in and out, or protraction, retraction. And then one of the other muscles is the serratus anterior. I like the serratus anterior. It helps to draw the shoulder blades down a little bit and keep them close to the rib cage. So it actually attaches in here in the medial border of the scapula, and then it attaches to the ribs. So talking about how the joints move, let's first talk very specifically about the shoulder joint. So our shoulder joint, just like our hip joints, are a ball socket. So it moves 3 different ways, and then it's also got circumduction, where we can do full arm circles. But it flexes, extends. So shoulder flexion is being able to reach your arms up overhead. This is shoulder flexion. This is shoulder extension. Then we've got abduction, ABD, adduction, ADD. And then we've got, best way to show this here, I'm going to spin him around, is to see internal and external rotation. So being able to take your hands, or your arms rather, in your arm bone in the shoulder joint, in the socket, being able to do this. External rotation, internal rotation. Okay. Our shoulder blades also move 3 ways as well. One I've already talked about, the protraction, retraction. We've got elevation, depression. Upper and mid traps help to do that. The rhomboids again allow the shoulder blades to retract, go towards the spine, and protract, move away. So basically this and this, okay? And then we've got, of the 3, I think this one's the most important, and that's that upward rotation. Now, if you've ever taken one of my yoga classes, you know I talk a lot about shoulder mobility, and what we have available to us in the shoulder joint is very much dependent. There's the very critical link on how well the shoulder blades move. And it's that upward rotation where we tend to get a little bit in trouble, or what we call stuck shoulder blades. They just don't really move all that well. Let me prove that to you. So a lot of us in our daily life, right, we might read a lot, we're on our devices a lot, we're on a computer a lot, I drive a lot, getting to and from classes and clients, maybe you work at a desk all day. What's our posture? The forward head, rounded shoulder posture. Any kind of work that has our hands like this for a fair amount of the day, our muscle structure is going to form to that, and it'll be rounded shoulders, forward head. So put yourself in that position. I invite you to do this along with me. Forward head, rounded shoulders. Now go ahead and lift those arms up. Okay, first of all, how do they feel? Mine don't feel good. And then secondly, how well do they move? Mine don't move well because they don't feel well. Okay, now just kind of be a little bit more aware of posture. Okay, not that we want to overly pull or overly brace and pull ourselves back and get real rigid, but just really be aware of the posture. Feel the shoulder blades move a little bit, do some shoulder rolls, kind of pull that chin in, watch that ear over the shoulders, and now, whether you're sitting or standing, now go ahead and reach those arms up overhead and see what's available to you. Some things to watch for is, as the arms go up, if you're a little bit stuck, you might do some of this, right? We're going to start to get the neck involved, or we're going to start to see those ribs flare. So let me do that again. It'll look something like this, right? So we've got other areas of the body, right, that should be calm and quiet and helping us, like our core and our back, helping us to stay strong as we breathe, as we're reaching for something that's up overhead and being able to bring it down. But again, because those shoulder blades are stuck, they just don't move well, so therefore our arm bone isn't going to move well. So I want you to explore that a little bit. I want you to practice some of that forward head. I want you to just sit up nice and tall. Notice your shoulder blades. Just kind of make that connection here with this part of the body. I always say that the back side of the body is kind of hard. Our posterior chain is kind of hard to connect with because we don't see it, right? It's behind us. We don't really feel it much because it's behind us. We don't think about it. We're not very conscious of it. So that's part of it. That's a big part of it, actually. So just kind of focus on the shoulders here and doing some shoulder rolls, and then just focusing on that head and neck, kind of staying over that shoulder. See how that tissue feels. See how that tissue responds. That's number one. See what's going on. I invite you to play around with that, experiment with that. Be watching for part number 2. Part number 2, I'm going to show you some movements or some exercises that you can do we kind of test that tissue and release that tissue. Leave me comments, ask me any questions that you want to, and continue to have a great day.